Hello, my name is Hunter Morrison. I'm a senior at Indiana State University, and this is my ATTR 413 experimental learning project. So to give a little context into my project, I was a working pharmacy technician who had just been certified to administer vaccinations, and I am able to administer flu and COVID vaccinations at the time of recording this. And I had a mother and a son come into my place of work, and the mom was wanting the son to get a influenza vaccine, but the child did not want to get it. Made that very clear that the child did not want to get it. So the people involved in this were the pharmacist, whose role it was to make sure that the patient was safe while overseeing my involvement with the patient. I was the person giving the immunization, and the mother of the child was there as the guardian and to make sure that the child got the vaccination. So the problem that we faced was the child did not want to get the routine seasonal influenza vaccination. Again, the child was around 12 years old. They had conscious thought, but the mother was doing what is in the best interest of the child. And so the 4 ethical principles, autonomy fits into this one. It's kind of a gray area in terms of children not wanting some procedures or not. Of course, the child has the ultimate say, but with the influence of the mother who was telling the child that they are going to get it and that there was no other exceptions, it kind of went against the child's autonomy. The child did not want the vaccination, but the mother insisted that the child get it. So that was kind of just where the autonomy is a little bit of a gray area. In terms of beneficence, as a medical care personnel, I am obligated to have my job center around providing beneficial care to the public. And in terms of what I do, it's mostly just filling prescriptions, being able to hand them to the public, and give vaccinations for COVID and influenza. In terms of non-malfeasance, even though there's a little bit of pain associated with when the needle goes in, the vaccination is not harming the person, it is benefiting them. So there's not too much of a non-malfeasance violation here. In terms of justice, the behavior of giving or administering a vaccination is a just one. It's been around for almost a century now. So the outcome was I gave the child the vaccination, even though he did not want it. I consulted with the pharmacist to make sure the child needed the vaccination and they were getting the right one. And then the mother was there. She signed off for the child to be getting the vaccination, and their contributions were helpful. The child would not have been able to get the vaccination without the mother signing off, and the pharmacist was there to make sure that everything went smoothly and the child did need the vaccination. The organizational policies influenced the outcome by allowing me, a pharmacy technician, to be able to administer the vaccination. So in terms of how did this situation affect me, it affected me by making sure that I do what is always in the best interest of the patient, even though they may not want it. Now again, I will always make sure that the person's autonomy is at the highest level of priority, but in this specific example, that it was benefiting the patient to be able to be getting the vaccination. So that's kind of how it affected me. It made me more empathetic to children because, of course, I remember when I was a child, I did not like vaccinations. I would kick, scream, and cry as well, but I knew that it was in the best interest of mine, and every time the nurses or the medical staff was always very empathetic in making sure that I felt good when receiving the vaccination. That's what I wanted to have for the child as well. So what changes have occurred in me as a person? I am definitely more empathetic toward those younger individuals as a result of this specific experience. I am more understanding that the fear the child has is a just one. Of course, nobody likes needles, but it was the right thing to do to administer the vaccination. So what changes have occurred in me as a future medical professional? Definitely being better at talking to children in a medical setting, calming them down if they are anxious, worried, or just not wanting to be there. So definitely talking to them, being able to talk to the parents as I see the parent is fearful or a little anxious regarding what is going to happen to their child. So being able to talk to them and kind of quelch those fears is definitely one that I will gain going into being a future medical professional. And then how have my skills changed or improved? My skills of giving vaccinations to a squirming child has definitely improved, and my manners when dealing with hesitant and scared patients has improved. Again, just talking to them, making sure that they feel heard and that they have a clear choice in their medical care is definitely one of priority. And how will I influence policies and innovations as a result of this experience? I will try to influence pharmacy technicians being able to give all kinds of vaccines, not just COVID and flu, but to go beyond that and being able to give like Shingrix, the shingles vaccine, pneumonia, Tdap. This will allow me to interact with a larger age group of people, and also being able to administer multiple different vaccines. So again, my name is Hunter Morrison, and this has been my ATTR 413 experimental learning project. Thank you so much.